Welcome. I'm Allie Shansfeld, Managing Editor of Implant Practice US, a Medmark publication. Today, we're going to talk to Dr. Terry Work and look at how the introduction of CBC technology has positively impacted his practice as relates to his patient experience. You can hear firsthand how the introduction of CBCT scanning has increased patient acceptance, how he markets the technology to his patients, and how he explains the benefits from a treatment planning aspect and from an overall increase in patient care. Before we get started, I'd like to invite our viewers to use the question and answer app in Google Hangout to ask any questions that you have, and those will be answered at the end of the session. I'd like to introduce you all to Dr. Terry Work and tell you a little bit about him. Dr. Work earned a Bachelor of Science degree at the University of Oregon before continuing on to dental school at Oregon Health Sciences University. After joining the U.S. Navy, he served as a Navy dental officer for 4 years before setting up his private practice in Scottsdale, Arizona. He has more than 20 years of experience as a practicing dentist and is an ambassador of education for Instradent, a global provider of dental implantology and tooth restoration systems. He also lectures on implant placement and bone grafting techniques. Dr. Work is a member of the American Dental Association, the Arizona State Dental Association, the Flying Dentist Association, and is a diplomate of the International Congress of Oral Implantologists. Dr. Work, welcome today. I have some questions for you. My first question is, you've owned your OP300 Maxio system for 2 years. Can you tell us how your patients have reacted to the introduction of 3D when you first got your system?
Sure. Thanks for having me on, by the way. I started placing implants, it's been about 12 years ago, and I realized that I had training in guided implant placement, and so I've used CT scans for placing implants and educating my patients on the need for implants. And so I would have to refer them out to either a scanning center or have a CT scan van come to the office, and I decided it became quite inconvenient. So we introduced the CT scanner to our patients, and it was really easy because we already had a panoramic radiograph machine, and the OP300 is very similar in appearance to the panoramic radiograph machine. And so it had the kind of footprint. We just replaced the old machine with the new CT scanner.
What was the common reaction to seeing the patients, to seeing their 3D images, and how do you think they felt when reviewing their treatment plan? Can you talk a little bit about the differences that you've seen in patient communication before having 3D and then after implementing this technology?
Sure. All dentists have tried to explain to a patient what they're looking at when they look at a radiograph. It can be very confusing for patients who don't look at radiographs every day like we do. So they're just looking at a kind of a blurry black and gray and white picture, and it's hard to distinguish exactly what they're looking at. With a 3D scanner, it takes all that information and places it in an organized form that they can more easily relate to. Depending on the size of the scan, it's a portion of their skull. It can be spun in 3 dimensions, and they can immediately understand what they're looking at and ask questions, and they become involved in their own treatment. And it's a huge benefit for the patients because they understand what they're getting into before the treatment is rendered, and so it makes them much more comfortable.
Have any of the patients expressed concern about radiation dose levels, and how do you dispel those concerns and talk to them about low-dose technology that's offered by the OP300?
Well, that's a continuing problem with dentistry and actually medicine as a whole. People have concerns about radiation exposure, and as a clinician, I have concerns about providing good care. Safety is of the utmost importance for our patients. However, we need to utilize the technology we have to get the best outcome. There's an acronym called ALARP, and it's as low as reasonably possible when it comes to radiation doses. And what that means is the clinician has a responsibility to weigh the benefits and the disadvantages of any doses of radiation. If they have an opportunity to use this technology and save the patient a potential cancerous lesion or something like that, then it makes it much more possible to convince the patient this is the way to go. If you don't take any radiographs or do any CT scans, there's a possibility to miss a lot. If you utilize the technology haphazardly, then you're not working in the best interest of your patients. So it's the responsibility of the clinician to balance those things to make sure they end up with the best outcome.
So has the introduction of the OP300 Maxio changed patient acceptance rates, do you find? And are you doing more complicated procedures because of that?
Well, it simplifies the treatment plans, that's for sure. When I go into a consultation and I have a 3D image of that particular person, it's one thing to have an image of some person, but when you're talking to a specific patient and you can show them, what I tell them is I tell them, hey, this is basically you without any skin, and this is what the bone looks like, and this is why, for example, we need to do a graft, or maybe we need to do a sinus elevation, or maybe we need to do a procedure that they don't really understand. By having the 3D image, I can very easily explain to them, this is why I'm charging a little bit more than just for a regular implant. And so the patients very quickly understand. We get cases where people say, hey, can you email that to my husband? Or can you print a copy of that? That's really interesting. So it gets them involved in their own treatment. And the way we say it is it's myself and the patient against their dental problem, not me against the patient. So we can step on the side of the patient and look at this image and say, here's why we're recommending what we recommend. And they really appreciate having that technology convenient for them. So it makes a huge difference in treatment plan acceptance.
It sounds like it makes it a lot more effective for both you and the patient. So that's exciting. When you were first considering 3D, what was your biggest obstacles to making that investment?
Well, when the 3D machines first came out, they were quite large and they were quite expensive, and it was something that I didn't feel made any sense for my particular practice. My office, I've been in this office for about 18 years, and so the area where the 3D scanner needed to sit was already a predetermined size, and my panoramic machine was there. So one of the things was machine size, the footprint of the machine. And the OP300 was perfect. It looked very much like a panoramic radiograph. In fact, one of the advantages that it has a double sensor head that flips around for either panoramic radiographs or 3D scans. So when I'm using when I'm doing a new patient workup, not every patient needs a 3D scan. So we'll do the panoramic panoramic radiograph. Then if I find something on that panel that that I'm not certain what it is, or I want a little more information, I'm taking the patient back to the very same machine they've already seen, so they don't have to get used to a new thing. They don't have to go to a scan center. We don't have to reappoint them. It's very convenient, increases safety. You had asked earlier about whether I do more complicated surgeries. I do the surgeries that I do, but I have a higher level of certainty about how they're going to go. Therefore, the procedure is more efficient, it takes less time, and it's safer for the patient. So convenience and safety are a big thing. And then, as every dentist will tell you, cost. You can't buy a piece of machinery. You can, but you shouldn't buy a piece of machinery that can't support itself. It needs to be something that that pays for itself and is useful for the patient. So this machine had a price point that I thought made sense, and so that's why we ultimately purchased it.
You answered, that was my next question about why you picked specifically the OP300 Maxio. Very good thinking ahead. If you could tell doctors considering investing in 3D technology 3 things, what would those 3 things be?
Well, again, we already talked about cost. That's kind of important because it has to support itself. The size of the machine has to fit into your office. That's the second thing. The third thing is pick a machine that has software that makes sense to you. It has to be user-friendly. has to be easy for your technicians to operate. The software for the OP300 is pretty intuitive. It's extremely extremely detailed. You can do so many things, and it's nice to have support so they can help you utilize the machine in a way that serves the needs of your patient. So I guess those three things would be what I would recommend.
Great. Okay, well now I've asked all my questions, and now I invite the audience to ask questions using the question app. And I see that we also have a question app on our website. So there's two different ways to ask us questions, and please feel free to do so right now. I do have one question. What, if any, objections do patients have when you order a CBCT, and how do you handle those?
Well, when a lot of the patients, we don't necessarily advertise every patient that we have a cone beam scanner in the office. A lot of times what happens is a patient will come in on a routine exam, we'll see something on maybe either a panoramic or a periapical, or they'll come in with a chief complaint. And so then at that time we say, well, I need more information, so let's get a cone beam scan so we can see this in 3 dimensions. And usually the patient will kind of look and say, oh, that means another appointment, I have to go someplace else. And when I say, no, it's just down the hall, and we can do it right now, and I tell them the fee, and they are relieved almost always that they don't have to make a new appointment, that they don't have to fill out more charts, that they don't have to meet new people, or they don't have to Google map a scan center. So they're actually a little bit relieved that we can take care of it then. And then it's funny because when I take a regular radiograph, people are less likely to ask me to see that. But when I take a cone beam scan, they always seem like, well, can I look at that, kind of see what you're looking for or what you're looking at? And then we sit down together and we talk about all of the possible reasons that they may be having an issue, or we're replacing a missing tooth, or there's a number of different reasons we take cone beam scans.
Okay, so you feel like case acceptance goes up when you use a CBCT rather than a 2D imaging modality?
Absolutely, yeah. It's more for complicated cases, multiple implants, that kind of thing, or guided surgeries. But to be honest, there's times where I'll be doing an endodontic procedure and I'll be having trouble finding a canal, and I can set the machine to the endo setting and get a very detailed picture of that tooth, and a lot of times I can find a canal that was otherwise difficult to find.
So this often prevents multiple radiographs. Do you communicate that to patients that who are afraid of the extra radiation or the extra cost, that this one scan can take the place of multiple 2D radiographs?
Yeah, it does. It takes multiple images. You can just look at the same area. What I tell patients who are concerned about radiation is I say, we're looking at a fairly small area, so what we'll do is we will take a small area that we call it the area of interest, and we can adjust it on our OP300 and just take a small cylindrical view and look just in that area. We're not doing large scans unless I may have a teenager that has what appears to be difficult wisdom teeth. Then we use the larger volume so we can get all 4 wisdom teeth in the view, and then we can better estimate the difficulty of the procedure. So it takes multiple radiographs, but in a very small area. So, the radiation question from patients, it's always a difficult one, especially here in Phoenix, where you have the bright sun. I generally will say, you know what, if you're worried about that, just make it a point to not go out in the sun for a couple of days, and you'll probably be about even. So you try to put it in terms that they can understand, that they can relate to, and you try to show them the importance of getting this diagnostic information so that they become part of their own health.
Are you surprised at the way that a CBCT has become an integral part of your practice rather than what your first ideas of having one in the office were?
Well, as I don't think we mentioned this, but my wife is also a dentist, and we practice together. And I've been trying to get a CT scanner for a couple of years, and she had always said, well, we can't really afford it, this, that. And so we always had that pull back and forth where I want to buy everything and she doesn't want to buy anything. And so we went back and forth. And so after we got it, it was within a month, she saw that it was the right decision because we were able to provide the patients with a level of care we just couldn't before. If you have a patient that you're not sure whether they need a CT scan or not, and you don't have one, then you probably won't refer them out for one. But if you have one in your office and you get it, you're always pleasantly surprised at the information you get. And it's also good. Let's say in my practice, I do lots of surgeries. I've just gotten training in implants and oral surgery and such. But let's say you're a GP and you don't do a lot of surgeries, but you refer out a lot of stuff. You could send a referral to a surgeon or an endodontist or periodontist with the CT scan in hand, and then it's just a lot more efficient for the patient. And I think the specialists would appreciate your foresight and appreciate your organization. So I think you can use it in a lot of different ways.
Excellent. That's all the questions that I have right now. Unless you have anything to add, do you have anything to add that I haven't asked you so far?
No, I think you were very thorough.
Thanks. To learn more about Instrumentarium Dental and OP300 platform, call 800-558-6120 or visit yes.op300.com. I think that should be coming up on your screens. And learn how increasing patient acceptance can positively impact your practice. Before we close, all our listeners are invited to attend the first ever Dental 3D University, which is going to be called 3DU, hosted by the Kalo Kerr Group imaging brands Gendex, Nomad, Sordex, and Instrumentarium. 3DU is an exciting two-day event that promises to provide dental professionals with an educational environment dedicated to cone beam 3D CBCT solutions that will enhance the practice and put them in full control of treatment outcomes. 3DU will be held October 1st through 2nd, 2015 at the Hilton Chicago in Chicago, Illinois. For more information and to register for the event, visit dental3du.com, which I think is also going to be showing up on your screens. Register before August 16th, 2015 and receive an early bird discount of $300. Dr. Work, we appreciate your insights into 3D imaging. We appreciate your time and thoughts today, and we thank all of our attendees for joining us today. And until next time, we say goodbye, and we'll see you at the next Hangout.